I agree that pregnancy comes with a lot of anxiety. A lot of women, especially first time moms, are faced with this. They're so anxious. So, what will I do in this early phase of pregnancy now that my baby is still developing? What am I going to do so I will not make a mistake? I don't want my baby to be malformed. I don't want to have a miscarriage. I don't want my baby to come out and be looking weird. All these things can make you feel very anxious. In this video, I'm going to show you 5 top things you need to do during your first trimester. Remember, your first trimester is one of the most important parts of your baby's life, because it's during first trimester that your baby develops their neurological system, like their brain and their spinal cord. It's during this first trimester that most of the organs start developing. So you need to be very careful on what you do. Make sure you do the right thing and avoid things that will cause harm to either your baby now or in the future. Number 1 tips today for first trimester is start your prenatal vitamins early. Prenatal vitamins are very, very important for your child brain and spinal cord development. I know you must have seen some babies that are born with bulge on their back, or their legs are curved like this. Some of these things, or most of them, are as a result of their mom not taking prenatal vitamins, especially folic acid, in the early phase of pregnancy. You don't want your baby to have problem with their brain development or their spinal cord development, or their leg looking somehow. Number 2, avoid unprescribed medication. A lot of people are going to give you advice. Madam, oh, the fever you're having is malaria. The fever you're having is typhoid. Oh, or you can even tell yourself, oh, you know what, before I got pregnant, I used to treat typhoid and malaria every time. I know this is typhoid. Once I take this medication, it's going to go. It's a lie. Don't take any medication that is not prescribed by your doctor, because you can take a medication that is harmful to your baby's organ. Let's say 2 years ago, I met this lady. She was very sick then and she was pregnant. I advised her to your hospital so that they can take care of you and give you the right treatments, because I don't do home treatment. Then I was working in the hospital. I don't involve myself with home treatment or anything like roadside treatment. I always want you to go to the hospital. And she was attendance letter in a good hospital. That was the last discussion we had. Then a few months along the line, I saw her. She has already had a baby, and I was like, oh, you have delivered. How is your baby? I said she lost the baby, and I was curious what happened. She said after I told her to go to the hospital, she didn't go to the hospital. She went to one, in quotes, nurse, because I can't certify if he's a nurse or not, in quotes, nurse at home, who gave her medication. I started to show me the picture of the medication, and I saw the pictures, and it happened that one of the medication that was not supposed to be taken during pregnancy, and she used it to treat typhoid, which made her baby to come out deformed. She said, she showed me the picture of the baby, the leg was deformed, the head was small, and that was how she lost her baby. So please don't take medication that is not prescribed by your doctor. Tip number 3, regular exercise. If you don't have a previous loss of pregnancy, or you don't have a tracing miscarriage or any pregnancy bleeding, please make sure you exercise. By exercising, I'm not asking you to go beyond the threshold you used to do before. I'm not asking you to get registered in a gym or anything. Just dancing at home, swimming, walking around, evening walks is enough. So you can do those things at the comfort of your home or outside your compound, just to make sure that you keep your heart and your body system active. Tip number 4, avoid alcohol and smoking. Please, if you are still with me at this point, I want to take a few minutes of your time to ask you to subscribe to my YouTube channel, where you always get pregnancy tips, fertility tips, and childcare tips from a trained medical doctor. I know that you don't want to miss out on any of my videos. Remember to hit the notification button to always know when I upload a new video. Thank you so much for subscribing and for liking this video. Talking about alcohol and tobacco, these two are worst combination you could ever have. Whether you're just alcohol or just tobacco, please don't, including shisha, because some people don't know that shisha is as harmful as other tobacco products. Don't indulge in them. And apart from indulging in them yourself, make sure that your partner or your friend or someone that is close to you, or that you don't hang around in an environment where they smoke, or in a lot. It's also going to make you a secondary smoker, and it can still affect you. Don't take alcohol, because alcohol can harm your baby's brain development and cause fetal alcohol syndrome. You may not see the features physically, but it may still affect your baby later in life during their development. Stay away from alcohol. And if you are watching this video and you have already taken alcohol, please stop taking them and be very religious with your routine drugs at this point. Tip number 5: get enough rest. You need a lot of rest in your first trimester of pregnancy. A lot of rest, because you don't know how you and this pregnancy you're handling yourself. So as much as possible, whether you're working or you stay at home more, make sure you schedule your rest period. Don't go and do past yourself. Always ask for support when it's going beyond you. Don't go and do past yourself. Oh, I have a bonus tips, and before we go into the bonus tips, please remember to subscribe to my YouTube channel to always get important tips you need during pregnancy or during your TTC journey or childcare. Thank you so much for subscribing. The bonus tip is remain well hydrated. Hydration is just taking fluids in form of water, juices, water-based fruits like watermelon, tomatoes, and the rest. Make sure that you always take water. If you're in the tropics like Nigeria or West African countries, or other countries where the temperature is usually very high, please, you need to take at least 3 liters of water every day to help with your regulate your internal body system and your organ function, to make sure that your baby gets enough and you also have enough to maintain your kidney and your other organs. I'm sure you're going to be a fantastic mom, and don't be anxious about anything. And remember that you can join us at Predify 24-hour doctor's care. So always have a doctor that is available to you to ask questions, resolve your complaints, and join our weekly pregnancy classes, all at the comfort of your home. See the link labeled Join Pregnancy Care in the description box, and I can't wait to see you in our in-house pregnancy support. See you in my next video. Bye.